to address the inquiry and all those who have been touched by the tragedy of the UK Covid-19 pandemic. I represent the Executive Office, which I will also refer to as the TEO, one of the 9 government departments in Northern Ireland. TEO supports the Northern Ireland Executive, which is made up of 5 different political parties in a mandatory coalition. Each of the 9 departments are independent, and matters only come to the Executive for decision making if they are significant, controversial or cross-cutting. The model of devolution in Northern Ireland is radically different to others in the UK or indeed Westminster. The remit of the Executive Office is to contribute to and oversee the coordination of executive policies and programmes in order to improve the economic, social and environmental well-being of the population. Within this remit, TEO has policy responsibility for civil contingency planning matters, specifically for the coordination of civil contingencies and emergency planning, including the wider consequences of disease outbreaks, as in this catastrophic case. The First Minister and Deputy First Minister are joint ministerial heads of the Executive Office. They are accountable to the Northern Ireland Assembly for their policies and programmes and for the activities of the department, including its arm's length bodies. All civil servants in the Executive Office operate under their direction and control in discharge of their functions. The head of the Northern Ireland Civil Service, also referred to as HOCS, was the Permanent Secretary to the Executive Office during the period under investigation in this module. In June 2021, the Northern Ireland Civil Service created a new Permanent Secretary role within the TEO to lead the policy agenda and delivery. Dr. Dennis McMahon was appointed as Permanent Secretary on 26th of July 2021. We will hear from Dr. McMahon in due course during this module. During the response period, the head of the Civil Service chaired the Central Contingency Group, or CCG. The CCG is the principal strategic civil contingencies preparedness body for the public sector in Northern Ireland. Now, one thing that is important to note, my lady, is that you will have seen that there were no ministers in government in Northern Ireland between the 16th of January 2017 and the 11th of January 2020. The Executive Office performed its functions during that period within the constitutional confines that applied. In this respect, my client was acutely aware of the importance placed by the inquiry on the question of any impact of the absence of an executive in that period. The ministers returned to office on the 11th of January 2020, and the Minister of Health attending the first COBRA meeting on the 29th of January 2020. Clauses for the inclusion in the Coronavirus Act were discussed at the executive meeting on the 17th of February 2020. There was a special CCG Covid-19 officials meeting on the 20th of February 2020, and advice went to ministers on the 3rd of March 2020, setting out the command, control and communications, or C3 arrangements that would apply. It's also relevant to mention EU exit. TEO has also noted the evidence provided in terms of EU exit and the interest of the inquiry in this issue. The EU exit arrangements, including Operation Yellowhammer, had a number of very significant impacts on contingency planning arrangements across the UK. Given the unique circumstances which applied to Northern Ireland and the political sensitivities, the effects were more pronounced. Austerity. The impact of austerity has also been raised in the evidence to date. This is an important aspect of the inquiry which can help to set the context for TEO's evidence, specifically in terms of reduced staffing in the Northern Ireland Civil Service and also in terms of wider public service sustainability. The Executive Office is determined that the knowledge, recommendations and lessons identified by this inquiry will be treated with the utmost seriousness and importance. TEO can guarantee you and those who have suffered such profound loss that the Department will not be found wanting in responding to and comprehensively addressing changes recommended by the inquiry. The written evidence from the families of the bereaved has had a striking effect upon all who have heard it, not least TEO's team, charged with preparing for the contribution to this hugely important inquiry. Further, the Module 1 impact film demonstrates the depth of loss for people who were touched by the COVID-19 pandemic. It is impossible to view the film and not be moved. The inquiry's role in highlighting the perspective and lived experience of the victims of the pandemic, as well as the experiences of all those involved, is crucial. There is no substitute for this. We thank you and your team to the extent to which you have conveyed that moving experience. The modular approach, as well as the Chair's commitment to produce reports on each module, means that TEO can apply lessons from those as soon as possible. This means, in practice, identifying and learning from the best practice, mistakes and systemic issues that emerged during the pandemic, demonstrating the importance of good governance in support of decision-making, particularly when decisions have such a crucial role in promoting the well-being of the people who TEO serves. Engaging directly with people across all of society, including the equality groupings, to ensure their needs are incorporated into future plans, and simplifying organisational design, leadership and delivery of high-quality public services for everyone. This week marks the outward commencement of your investigation, my lady, to understand exactly what happened, when it happened and why it happened. The COVID-19 pandemic has had and continues to have such a profound effect upon society in so many ways. Those affected must be given truthful answers to the questions they have asked since the earliest days in March 2020. Those whose lives were irreparably damaged by the pandemic will rightly wish to know how future contingency planning in Northern Ireland can be designed to avoid any future failures. We share that quest to learn and will not be afraid to acknowledge when it is clear that government could have done better. My lady, those are my opening comments, and I'm very grateful for you listening to them.
Thank you very much indeed, Mr. Sharp. Mr. Strachan, sorry you've had to wait so long.
Good morning, my lady. I appear on behalf of the Cabinet Office today with Mr. Harland, who sits to my right. My lady, the Cabinet Office would like to start by expressing its deepest sympathy to all those who lost loved ones during the COVID-19 pandemic. It acknowledges the huge personal sacrifices which were made by families across the country and the dignity and bravery all those who continue to live with the effects of COVID-19. And the Cabinet Office pays tribute to the efforts and courage of public servants and all those who played a role in the response to the pandemic, from those on the front line of health and social care to the scientists who worked on the vaccine and all those across society who kept the country running. The impacts of the pandemic went far beyond the many whose health suffered directly. The virus and the measures taken in response affected the economy and society profoundly. This inquiry will rightly focus on COVID-19's profound effect on the United Kingdom, but it is right to remember that this was a global pandemic. It affected the lives of everyone. No country was left untouched, and each government had to make extremely difficult choices in mitigating the suffering and hardship caused to its citizens. The UK government established this independent public inquiry under the Inquiries Act 2005 to provide the United Kingdom with what may be the most ambitious inquiry into COVID-19 undertaken worldwide. And as the former Prime Minister stated when announcing the inquiry, it is essential the government's actions, its structures, processes and judgments are examined rigorously, candidly and objectively. So every possible lesson from this terrible global event as it affected the United Kingdom is learned and remembered. To prepare properly for a future pandemic of this kind, such reflection and learning is essential, and it will build on the scrutiny that the government has received through parliamentary inquiries and the National Audit Office. My lady, the pandemic was the biggest peacetime crisis our country faced in decades. Its consequences will be felt for decades to come. But it is important to recognise the many sacrifices that have been and will continue to be made across our country as a result of this virus. And that although the pandemic had profound consequences for all, its enduring impact on individuals, families, communities and groups will vary significantly. And the Cabinet Office welcomes the inquiry's role in considering the different impacts on all parts of our society, including those with protected characteristics under the Equality Act of 2010. Thanks largely to the vaccines, COVID-19 has now been brought under control, though the pandemic placed huge strain on our public services, and we are still, as individuals and as a society, dealing with the longer-term consequences. The government is seeking to address those consequences, for example, supporting those with long COVID, including funding research to understand better its causes, symptoms and treatment, and putting in place the elective care recovery plan to tackle the COVID-19 backlog in the NHS. The government's also taking actions to improve the UK's resilience, as set out in the UK government's resilience framework. The Cabinet Office welcomes the role of the inquiry in investigating the response of the Cabinet Office, as well as all other relevant government departments to this crisis. The inquiry should help us all understand what went well and what did not, so as to improve the response should a pandemic threaten our country again. There will be much to learn from scrutinising, with the full benefit of hindsight, what happened, first in terms of preparation, and then by examining the response to the breadth and scale of the crisis created by COVID-19. Lessons can and must be learned. For a global event of this kind, it will certainly be the case that things could or should have been done differently. The Cabinet Office's overriding aim is to learn all the lessons it can from such scrutiny and to make changes where appropriate to improve this country's resilience against such events in the future. Both history and science sadly tell us all of the need to prepare for future challenges to come. This inquiry offers us the chance to face them with an open mind and the best information possible. The Cabinet Office therefore remains steadfast in its dedication to supporting the inquiry in its vital work. In response to the inquiry's request for information in relation to Module 1, which, as Mr. Keith has identified, concerned the period dating back to 2009, the Cabinet Office has provided 8 corporate statements from senior officials currently working in key positions in the Cabinet Office. In addition, the Cabinet Office has supported 9 witnesses to provide Module 1 witness statements in their personal capacities, in which they set out their own views, reflections and suggestions for improvement in light of the requests from the inquiry to do so. These include the former Prime Minister David Cameron, cabinet ministers, former heads of the civil service. And a number of these witnesses will assist the inquiry by giving oral evidence during the forthcoming hearings. The findings of your inquiry will enable the country to be better prepared for any future pandemic, and the Cabinet Office is keen to use its conclusions to build and improve upon the changes it's already implemented to enhance crisis management structures. The Cabinet Office recognises that continuous learning is vital to maintain effective resilience. The remainder of my opening statement covers just two main areas. First, the role of the Cabinet Office at the centre of government, as Mr. Keith has referred to in his opening remarks. And second, a high-level summary of the learning of lessons which the Cabinet Office has carried out so far and the actions it is already taking forward to enhance resilience for the future. So first, if I may, just something on the role of the Cabinet Office. The Cabinet Office is a ministerial department of His Majesty's government. Its ministers currently include, among others, the Prime Minister, the Deputy Prime Minister, and the Chancellor of the Duchy of Lancaster, and the Minister for the Cabinet Office. The Cabinet Office is responsible for providing support to the Prime Minister and the Cabinet, and to ensure the government works together to deliver for the people of the United Kingdom. The Cabinet Office has a broad and fluid remit. Its key responsibilities include supporting collective government decision-making through the Cabinet and the committee system, as you have heard, supporting national security and coordinating the government's response to crises, and promoting efficiency and reform across government, and monitoring and driving the delivery of priorities by other departments. And as such, the Cabinet Office has a unique role in government which shifts in focus over time in response to priorities and challenges as they evolve. Within the Cabinet Secretariat, for example, the Cabinet Office houses teams that coordinate policy, manage decision-making, and look at issues that affect the whole of government or do not sit neatly within any individual department. A range of cross-government functions are based in the Cabinet Office. The cross-government functions, also comprising multiple agencies and public bodies, support departments and civil servants across government to be professional, capable and efficient, delivering strong value for money for taxpayers, mitigating and managing risks to operations, and ultimately helping departments deliver what ministers want. One such function is the government commercial function, which includes the Crown Commercial Service. The Equality Hub was created within the Cabinet Office in September 2020, when the Race Disparity Unit, Disability Unit, and the Government Equalities Office were brought together. The Social Mobility Commission Secretariat joined the Equality Hub in April 2021. And the Cabinet Office has overall responsibility for the budget and resourcing of the Equality Hub. This is discharged in agreement with the Minister for Women and Equalities. All of the ministers with equality responsibilities sit outside the Cabinet Office, and each has policy responsibility and decision-making authority on their specific equality issues. And whilst it's grown in recent years with changes in the machinery of government, at around 7,000 full-time equivalent staff, the Cabinet Office is smaller than some of the departments with large-scale delivery responsibilities. Since its work is not orientated towards tackling one individual issue or risk, its structure and resourcing model adapt as needed. Turning briefly to Cabinet government, in general, the vast majority of decisions in government are made within individual departments, but some decisions, such as whether subject matter affects multiple departments, need to be made collectively at Cabinet or a Cabinet committee, either at a meeting or through what is referred to as a write-around to a Cabinet committee. The Prime Minister of the day, with the advice of the Cabinet Secretary, decides the overall structure of the Cabinet Committee system, and there are broad principles and protocols set down in the Cabinet Manual, but there's no definitive list of decisions which must be taken by collective agreement. The Cabinet Office Briefing Room, or COBRA, committee is the mechanism for managing the central response to major emergencies which have international, national or multi-regional impact and are of the scale and complexity to require central government coordination. Consistent with its need to provide an adaptive response depending on the emergency, there is no fixed membership of COBRA. In general, the chair will be the Secretary of State of the Government Department with lead responsibility for the issue being considered. However, with reference to some of the comments already made about the role of the lead government department and also that of flexibility, it's also important to note that invitees will generally include representatives from those departments or regions affected by the crisis under discussion as appropriate. As to the framework for emergency preparedness in the United Kingdom, risks are managed by systems in which departments and organisations from the public, private and voluntary sectors work together at the local, regional and national level. The principal role of the Cabinet Office with regards to emergency preparedness is to set and operate the overarching framework for risk assessment, preparedness, response and recovery. The framework is founded in the Civil Contingencies Act of 2004, to which reference has already been made and the inquiry will be considering. This sets out, among other things, the role of local resilience forums as a mechanism for coordinating local emergency preparedness. And the framework has evolved through time with associated regulations and guidance, which is also shaped by other relevant legislation such as the Equality Act of 2010. The Cabinet Office carries out a wide range of activities aimed at understanding and enhancing preparedness for emergencies across the board, and this is underpinned by an assessment framework encompassing the most serious national risks facing the United Kingdom. Mr. Keith has referred to that part of the framework which includes the National Security Risk Assessment, the published National Risk Register, and prior to its amalgamation with the National Security Risk Assessment in 2019, the National Risk Assessment processes. The National Security Risk Assessment is the government's main tool for identifying and assessing the most serious risks facing the United Kingdom or its interests overseas over a multi-year period. As will no doubt be appreciated, the National Security Risk Assessment cannot anticipate every possible risk that might occur across the United Kingdom, but instead brings together groups of risks of a similar nature in order to facilitate the planning required to respond to those risks. The risks included in the National Security Risk Assessment are proposed by lead government departments based on their own expert internal advice. The National Security Risk Assessment process also includes panels of experts assessing the risks. The assessment is published and is subject to public scientific scrutiny. It underpins the development of national resilience planning assumptions. These set out the common consequences of the National Security Risk Assessment risks, and these are then shared with local and national responders to assist them in their planning to deal with the major national as well as more localised emergencies. And the focus on these common consequences, rather than solely on specific risks, is indeed intended to enable a flexible response to the widest range of scenarios. The National Security Risk Assessment is periodically reviewed. Reference has been made to the fact that specific risks and capabilities that are identified in the National Security Risk Assessment or the National Risk Assessments are the way they're managed by lead departments. They are influenced by the broader strategic context for that department, such as related policy, programmes, spending decisions, and international factors. Lead departments carry out cross-government coordination, chairing meetings as appropriate as needed to deliver their responsibilities. Other government departments also prepare for risks that the National Security Risk Assessment process has flagged up and attend preparation meetings. My Lady, the Cabinet Office does not audit other government departments in this sphere, but the Cabinet Office did carry out work which was intended to inform other bodies of their capabilities and to enhance preparedness planning. This has included work I don't think referred to as yet, such as resilience capabilities surveys, which were responded to by the local resilience forums. The Resilience Capabilities Programme, which sought to assess how certain work streams were being prepared for, sector security and resilience plans, which allowed lead government departments to set out their approach to the resilience of their critical national infrastructure, and the national resilience standards, which were intended to allow local resilience forums and others to benchmark their works against a consensus view of good and leading practice. Where potential impacts are sufficiently severe or wide-ranging across departmental responsibilities, the Cabinet Office may convene and coordinate across government, and that might include co-chairing official boards with the lead department to help ensure that wider system impacts are considered. The pattern and intensity by which Cabinet Office supports lead departments with their planning for specific risks varies by risk and through time. And as is typical for the centre of government, ministers and senior officials will have to decide what level of support they should provide to other government departments, based on what's known about the capabilities of that department, what needs other departments have, and the resources that central government can commit. The latter is informed by overall resourcing decisions and the landscape of emergencies and contingencies that the government is tackling at any one time. The Cabinet Office also has its own role in leading certain aspects of a response if one is required, for example, organising COBRA. While it can never be optimally positioned to respond to one individual risk, the Cabinet Office has channeled resources to meet specific emerging needs. And over the time period with which Module 1 is concerned, the most pressing risks at any one time range from civil contingencies to national security threats and wide-ranging policy and operational challenges. In the period immediately preceding COVID-19 pandemic, the dedicated team on the UK's exit from the European Union was the biggest single formation in the Cabinet Office. In 2020, those resources were reassigned to COVID-19 as the pandemic emerged. And by the end of that year, the COVID-19 task force had more than 300 people in it. This task force was wound down in the spring of 2022 after emerging from the pandemic, and the focus moved on to Russia's invasion of Ukraine. In terms of devolution, the government works closely with the devolved administrations to promote effective emergency planning and response that is, as far as possible, aligned across the United Kingdom whilst respecting devolved choices. Turning to the Cabinet Office's role in pandemic preparedness during the Module 1 timeframe, the work undertaken by the Cabinet Office in respect of pandemic preparedness is described in detail in the witness statements already provided to the inquiry. And as I've already described, the Cabinet Office coordinated the risk assessment process with input from lead government departments. Pandemic influenza was identified as the top risk throughout the relevant period. New and emerging infectious diseases were also included in the risk assessments and registers. And throughout the relevant period, health sector preparedness was managed by the Department of Health and Social Care. Beyond the Module 1 period, but noted here for completeness, in July 2021, the Department of Health and Social Care and the Cabinet Office jointly established the Pandemic Disease Capabilities Board to enhance the cross-government and cross-United Kingdom approach to preparing for a broader range of pandemics, including but not limited to pandemic influenza. If I may turn to lessons learned and actions taken to improve preparedness, I've already noted that the government set up this inquiry to conduct a thorough and objective assessment of its handling of the COVID-19 pandemic, with the ultimate aim of ensuring that all of the available lessons are brought to light so the country is better prepared when the next pandemic hits. COVID-19 developed quickly from an acute emerging threat to a pandemic requiring the whole of government to respond to a chronic challenge. And the Cabinet Office will support the inquiry to capture every lesson for our emergency frameworks and pandemic preparedness, including both where we need to build on existing strengths or address weaknesses in the United Kingdom's response. But the government has sought to learn and improve throughout the course of the pandemic in real time. The Cabinet Office has also commissioned a number of reviews and made a range of changes to improve resilience and preparedness more broadly, with further improvements in train. As I'll briefly explain, continuous learning and improvement are an inbuilt and vital part of the United Kingdom's resilience mechanisms. In terms of formal reviews, beyond the crisis, whilst respecting the inquiry's process and without prejudice to the inquiry's own conclusions, the Cabinet Office has carried out formal reviews in respect of resilience and preparedness, including the following. First, the Boardman Review of Cabinet Office Communications Procurement, which reported in December 2020, considering the preliminary results of a fact-finding exercise into the award of contracts for COVID-19 communication services made by the Cabinet Office in March 2020. It made 3 recommendations in relation to existing procurement policy and legislation, 13 recommendations in relation to Cabinet Office processes and governance, and 12 recommendations in relation to conflicts of interest and bias. And the Cabinet Office accepted all of these recommendations. Second, in January 2021, the Civil Contingencies Secretariat commissioned the Royal Academy of Engineering to undertake an independent external review of the National Security Risk Assessment methodology. And the Royal Academy of Engineering was asked to address a number of priority questions, focus on scenarios, concurrent and compound risks and interdependencies, assessment timescales and cross-cutting issues such as data, expert input and diversity and inclusion. It was also asked to deliver evidence-based, practical and implementable recommendations for improvement, and its report, Building Resilience, was published on the 21st of April 2023, and the Royal Academy of Engineering's review was conducted alongside an internal review by the Civil Contingencies Secretariat, and the Royal Academy of Engineering's review made 13 final recommendations, and the Cabinet Office accepted and has or is implementing the majority of these. Thirdly, the Boardman Review of Government COVID-19 Procurement, which reported on the 7th of May 2021, covered 5 key parts of the government procurement in response to the pandemic and identified lessons to be learned for future procurement, and it made 28 recommendations which the government has accepted, and implementation of these has mostly been completed and has been subject to review by the government internal audit agency. And fourth, in June 2021, the National Security Advisor commissioned a review into crisis capabilities in government, which reported in February 2022. And that review drew on lessons learned from recent crises, including COVID-19, and aimed to provide an examination of central government's approach to crises. And that made 23 final recommendations, which the Cabinet Office has accepted in full and has implemented them or is in the process of doing so. The Cabinet Office has also contributed to other third-party reviews and publications in respect of lessons to be learned from the pandemic and general resilience arrangements, including those conducted or submitted to Parliament, which sit outside the scope of this inquiry. And more widely, the Cabinet Office's role is shaped by other significant government reviews, such as the 2021 Integrated Review of Security, Defence, Development and Foreign Policy. And as to actions to improve preparedness, as a result of these reviews and publications, as well as internal lessons exercises, the Cabinet Office has already made significant changes to the way government deals with resilience and crisis management. Amongst other things, the Crisis Capability Review recommended that a new permanent Cabinet Office crisis team should be established, with its responsibilities to include owning and implementing plans for scaling up central government's response in the face of major crises. And following this, the Civil Contingency Secretariat was split into two. The COBRA unit now focuses on the government's response to emergencies, and the Resilience Directorate has been established to lead on longer-term resilience issues. The pandemic exposed the need for a material improvement in how government generates and interrogates data to support decision-making in a crisis. And as a result, the National Situations Centre, based in the Cabinet Office, was established and became operational in October 2021. And it now serves as a focal point for data and an analysis in emergencies. COBRA facilities themselves have been modernised and upgraded, including new physical office space and improved information and communication technology provision. And the Cabinet Office, which met for the first time in July 2021, bringing together national, regional and local government, private and voluntary sectors and other interested parties to improve communication and collaboration on risk and help align emergency preparedness activity. And in 2022, the Cabinet Office published the findings and recommendations from its review of the Civil Contingencies Act and also promulgated a new version of the National Security Risk Assessment. And my lady, the government published its new resilience framework on the 19th of December 2022, and the development and publication of that was a key commitment made in the integrated review, and it was prepared following a public consultation with input from across central government, the devolved administrations, local government, the private and third sectors, and of course the public. It sets out the United Kingdom government's plans to strengthen resilience to 2030. And the measures set out in the resilience framework include, first of all, delivering a new resilience, UK Resilience Academy, built out from the Emergency Planning College, with making a world-class professional training available to all that need it. Secondly, the creation of a new Head of Resilience position, responsible for guiding best practice, encouraging adherence to best practice and setting guidance. Thirdly, introducing an annual statement to Parliament on civil contingencies risks and the United Kingdom government's performance on resilience. Fourthly, clarifying United Kingdom government roles and responsibilities for each national security risk assessment risk. Fifthly, growing the UK government's pool of advisory groups of experts to inform risk planning and provide external challenge. Sixthly, strengthening local resilience forums in England. Seventh, building private sector resilience by providing guidance on risk in order to help the businesses to meet new standards on resilience. 8, continuing to deepen and strengthen the government's relationships with the voluntary and community sector in England so as to better understand and integrate their capabilities at the local and national levels. 9, developing a measure for social vulnerability as an indicator of socio-economic resilience, and how risks impact across communities and vulnerable groups in order to inform decision-making. 10, updating guidance with local responders, the voluntary and community sector, and communities to support them working with vulnerable groups. 11, conducting an annual survey of public perceptions of risk, resilience, and preparedness. And 12, establishing a comprehensive national exercising programme focused on priority national security risk assessment risks to test key capabilities and provide a stronger framework to capture and track lessons learned identified across government. And alongside the publication of the resilience framework, the Prime Minister formed a subcommittee of the National Security Council, chaired by the Deputy Prime Minister, specifically to consider matters relating to the United Kingdom's resilience. The government recognises there is always work to be done to ensure that the United Kingdom is well prepared for future crises, and to this end the Cabinet Office will listen carefully to the evidence and contributions from other core participants in Module 1 and looks forward to the inquiry's report and recommendations in due course. Thank you very much.
Thank you, Mr. Strachan. I gather I mispronounced your name. Please forgive me. You're not the first, and I fear you may not be the last. So please, anybody, if I do mispronounce your name, please tell me. I won't be at all offended. On the contrary, I'd welcome being corrected. So thank you very much.
Not all, my lady. I got used to answering to both pronunciations
I can
over
imagine,
the time.
yes. Right, that completes the submissions of the core participants. Mr. Keith.
Well, my lady, ahead of schedule, may I please call Professor Jimmy Whitworth and Dr. Charlotte Hammer to give evidence.
Thank you very much.
I do solemnly,
sincerely and truly
declare and affirm
that the evidence I shall give
shall be the truth,
the whole truth,
and nothing but the truth.
Mr. Whitworth, will you take the book in your right hand and repeat after me? I swear by Almighty God
I swear by Almighty God
that the evidence I shall give
that the evidence I shall give
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing but the truth.
and nothing but the truth.
Thank you very much. Take a seat.
Good morning, Professor Whitworth and Dr. Hammer. Thank you very much for the preparation of your joint report. As you give evidence, could I please ask you to keep your voices up? It's important that what you say is recorded, and more important perhaps still, that everybody in the room can hear what you have to say. If you don't understand a question, please ask me to repeat it. There will be a break at lunchtime. There may be an afternoon break if we're still going, but if you need anything or you need a break, will you please let us know? You have prepared a joint report. Could we please have it on the screen, INQ 000196611. On page 2 of that report, you've both signed it, Professor Whitworth on the 5th of June, Dr. Hammer on the 2nd of June, and you've both confirmed, is this right, that the report is your own work, the facts are within your own knowledge, and you believe anything else which relates to your report on which you have relied, and you understand your duty to this inquiry to provide independent evidence, and no doubt you will seek to comply with that duty. My lady, may I ask for your permission for the report to be published?
Certainly.
Professor Whitworth and Dr. Hammer, I'm going to put general questions. They're not directly related to one or other of you. Please decide amongst yourselves who will answer the question based upon your specialties and what I understand to be your consideration in advance of the areas about which I'm going to ask you. Your report and your own expertise concerns biosecurity. Could one of you please tell the inquiry in very general terms what biosecurity is concerned with?
To me.
Yes, I will take that. Thank you, Mr. Keys. So in very general terms, biosecurity are those questions that relate to the biological security, safety of populations, individuals, and societies. So these are things like outbreaks, so outbreaks of infectious diseases, for example, going all the way to pandemics, as we are discussing today. These are also things related to biological terrorism and biological warfare.
And are you both experts in that field of biosecurity, so the forecasting of epidemic trends, the transmission of diseases, particularly zoonotic diseases, biosecurity countermeasures and the like?
We are.
In the report, you have set out for us at page 1, if we could have page 1 of the report, please, a short CV of your most distinguished histories, setting out your expertise. Professor Whitworth, you are an emeritus professor at the London School of Hygiene and Tropical Medicine. You retired, I think, in 2022, but you were the Professor of International Public Health between 2015 and 2022, is that right?
Yes.
You were chair of the Ethics Committee. You have a vast experience of working in the field of biosecurity, both abroad in the United Kingdom. You're a fellow of the Royal College of Physicians, the Academy of Medical Sciences, and the Faculty of Public Health. And you are also, well, you are now President-elect of the Royal Society of Tropical Medicine and Hygiene. Were you at one stage a member of the World Health Organization European Advisory Committee on Health Research?
I was, yes.
May I ask you one or two questions, please, in relation to your work for the World Health Organization, because it finds reflection in a later part of your report, and it's an area that one of the core participants has raised questions about or sought to ask questions about. Were you a member of something called the Prioritization Committee?
I was, yes.
And was that a committee that undertook in 2018 a review of the prioritization of diseases for what was called the World Health Organization Research and Development Blueprint?
Indeed, yes.
Was it essentially concerned with trying to identify and then research and develop countermeasures against the most highly pathogenic, that's disease-like or those diseases which pose the greatest concern, including coronavirus diseases?
Yes, indeed. That is looking to identify those diseases that we're most worried about from the public health point of view, for which we don't currently have good tools.
And how long did you undertake that work for that committee?
Since 2015.
And did it report?
Yes.
And when was that?
After each meeting, there would be a report that came out. I think the most recent was 2018.
Thank you very much. You've also published over 250 scientific papers, and you've provided a link to a selection of all most recent articles in the report.
Indeed.
Dr. Hammer, you are the Everett Butterfield Research Fellow at Downing College, University of Cambridge, You're based in the Department of Veterinary Medicine, and you're a member of the steering committee of Cambridge's Infectious Diseases Directorate. And you specialise in the epidemiology of emerging and high-consequence infectious diseases and in health emergency preparedness and response. So essentially, your specialty lies in global health security and public health consequences.
Indeed.
And in 2022, of most relevancy, were you, and in fact, a consultant epidemiologist to the World Health Organization COVID-19 Epidemic Intelligence Team.
Yes.
And you've worked also for another notable and important international network called GOARN, G-O-A-R-N, the Global Outbreak Alert and Response Network.
I was a deployed consultant with them.
Thank you. So in relation to this report, you were instructed in January of this year, on the 20th of January, and at pages 3 and 4 of the report, we can see the broad areas of instruction. Page 3, firstly, issues concerning biosecurity threats, priority diseases, forecasting and epidemic intelligence, international processes dealing with surveillance and the control of infectious diseases. Over the page, please. And then you turn in your conclusions to the improvements that you suggest be made in infectious disease surveillance to prepare the United Kingdom for future pandemics. And hot off the press, in fact, this week, did the United Kingdom government publish its biological security strategy.
Indeed.
Have you been able to review that and to consider the improvements and recommendations that the United Kingdom government itself advances against the ones that you've suggested report?
Yes, though to some extent, since it only came out this week.
Yes, indeed. But your report, of course, preceded that strategy and its publication, but you've nevertheless been able to look at it. Thank you. Could we please turn to page 5 of the report and the commencement of the substance? And may I ask you, what is a pandemic?
So a pandemic, in essence, is a big epidemic. So an outbreak of proportions that span the world.
Are they a new development?
Pandemics, as far as we know, have existed as long as humanity.
And is it self-evident that pandemics may range in, although they are necessarily worldwide, they may range in impact, in their scope and severity?
Indeed.
You've set out in the first few paragraphs of your report a number of reasons why we need to be more concerned about pandemics than perhaps hitherto had been the case. Because you describe why the potential for infectious disease has, in recent years, greatly heightened. Could you please set out the broad reasons why you believe that the potential has heightened?
Certainly. Now, most severe biological threats that we are facing are transmitted originally from animals to humans. So that's what we call zoonotic diseases. And the risk for a disease to be initially transmitted from an animal to human increases with increasing contact between humans and animals, particularly if these animals and these humans did not have contact beforehand. So they did not share pathogens, diseases beforehand. Now, with a more and more interconnected world, we do have more contacts with animals. We do have movement of people and animals, meaning new animals are encountering new humans, but we are also impacting what is happening after a disease has jumped from an animal to a human, that is how much contact that human has, how high the likelihood is of that disease then causing wider spread.
So are there then two broad areas of concern? One is, we may call it the animal environment, the interface between animals and humans, which gives rise to the risk of a virus being transmitted into the human race. And then secondly, once transmission has occurred, there is the concern about population density, migration, travel and trade, which encourages greater and wider transmission.
Absolutely.
Can that transmission, can the infection point occur at any time or in any place zoonotically? That is to say, the movement or infection of humans by an animal virus, or are there places in the world where it's more likely to occur?
Generally speaking, this can happen wherever an animal has a disease that is suitable to infect a human and then has contact with a human. There are, historically speaking, some places where this has occurred more often, but that does not mean that this is not possible in other places.
At paragraph 5 of your report, towards the bottom of the page on the screen, you've identified, in fact, a longer list of major drivers. So microbial adaptation and change. What does that mean?
So when we're talking about microbial adaptation and change, that is, broadly speaking, which species a microbe can infect. So that would be the potential to actually jump to humans, because at the end of the day, we are just one of a whole range of species. And that is also hinting at antimicrobial resistance, which is another large biosecurity concern.
And we'll come back to that in a moment. Ecological changes favouring the multiplication of a specific microorganism. What is that a reference to?
So there we are seeing things like, for example, changes related to climate change and also changes related to things that are also mentioned in the further point of land use change. So what kind of environment we have around ourselves, and that impacts both the animals as well as the pathogens. And in between those two, also vectors. So think about insects, for example, that have a different range with climate change.
And is a vector, does the word vector mean the means by which a disease may be transmitted to humans? So it could be by way of a flea or an animal or indeed even perhaps a surface or airborne or whatever it might be.
There are two meanings to the word vector here. First being what you just described, so where it could also be a surface, so a means of transmission. The second, which is what I was more referring to just now, is usually an insect or a similar entity in which a pathogen can exist but is not infected. So it wouldn't be an animal that is infected, but it would be something like certain species of fleas, it would be something like certain species of mosquitoes. That depends on the pathogen.
All right. Why is climate and climate change of relevancy?
So as you probably are already seeing, these are all interconnected, and climate change are driving certain ecological changes and changes in vector ranges specifically.
Further down the page, please, or over the page. You've referred to increasing international travel and commerce already. Then there are direct human influences, including technology, which have impact upon agriculture and land, increasing human population with urbanization, human behavior, again, you've covered that, immunosuppression in a substantial group of individuals. What is the relevancy of that?
So if we have a group of individuals, especially a group of individuals who are in contact with each other, who are particularly susceptible because they are immunosuppressed, we simply have a higher likelihood of spread.
You've referred to the word pathogen or pathogenic. What does that mean?
So when we talk about a pathogen, we talk about a microorganism. So that could be a virus like SARS-CoV-2, which is the virus causing COVID-19. That could be a bacterium. It could be a fungus. And so we group those, and together we call them pathogens.
All right, thank you. Now, it's also necessary to set out some other building blocks concerning the field of biosecurity and pathogenic research. Could we please have on the screen 000207453? Perhaps not. Oh, yes. Professor Whitworth and Dr. Hammer, this is a reference table of previous pandemics and major epidemics prepared, in fact, by the inquiry team. I'm sorry that you haven't been provided, I don't believe, with a hard copy. But essentially, it sets out the major pandemics and epidemics, obviously, and a certain amount of information relating to each. And I want to just take you through the list, please, very briefly, in order that we may begin to understand the names of and recognise some of the major pathogenic threats that we and the world have faced over time in order to put coronavirus SARS-CoV-2 in its proper context. So commencing towards the top of the page, you'll see 1918 to 1920, influenza, H1N1. We don't, I think, need to zoom in, but because we're going to look at the table as a whole. That, of course, is what became known as Spanish flu. Is that right?
Yes.
We can see, and the most important part of it, the most important information is towards the right-hand side of the chart, where information is provided in relation to the number of UK deaths and the case fatality rate, as well as the transmission route. What is the case fatality rate, as you understand it?
So the case fatality rate means the proportion of individuals who have become ill who die.
And therefore, does the case fatality rate indicate the severity?
It does.
Of the disease? Influenza H1N1 Spanish flu was a respiratory disease, is that correct?
Yes.
Further down, the next entry on the chart is 1957 to 1959, H2N2. We'll come back in a moment to what the H and the N signify. But was that Asian flu?
I believe so.
And on the right-hand side of the page, we can see the case fatality rate was very much lower at 0.017 to 0.1%. But again, a respiratory pathogen. (1968 to 70), influenza H3N2, that was known as Hong Kong flu. What does the H in the lettering indicate, and what does the N indicate?
The H is hemagglutinin and the N is neuraminidase. So they're referring to different elements of the influenza virus.
I knew you'd know the answer, Professor. Does the H or the N indicate, in broad terms, the source of the genetic makeup of the virus? So, for example, does H indicate that the virus emanated originally from a mammal or a bird or something of that sort?
In broad terms, yes. but you can't be confident whether it came from a bird or a mammal just from the H and the N nomenclature.
Right. Then we can see in 1977 to 1978 influenza, H1N1. That was a influenza that had its possible origins in China or Russia. It became a global pandemic, also called Russian flu. And then 2002, 2003, coronavirus SARS-CoV-1. So SARS plainly stands for Severe Acute Respiratory Syndrome, coronavirus, CoV coronavirus 1. This was the first coronavirus, is that correct?
Yes.
A moment or two on SARS-CoV-1. It commenced in 2002, is that correct?
Yes.
It spread throughout 2003, I think starting in Hong Kong. It was notified to the world by an organisation called ProMed, about which we'll hear more later. Towards the middle of the page, it killed 774 people worldwide. In the United Kingdom, there were 4 cases and no deaths, but the case fatality rate was around 9.6%. So in terms of the severity, it was very much more severe than the preceding influenza and other pandemics to which I've made reference.
Yes.
2009 to 10, influenza H1N1, was that swine flu?
It was.
Swine flu struck the United Kingdom amongst other countries. If we go to the right, the middle of the page, global deaths have been assessed at 284,000. In the United Kingdom, there were 28,000 odd cases and tragically 457 deaths. But the case fatality rate was, by comparison to coronavirus SARS-CoV-1, very much lower at 0.01 to 0.02%. Is that why the review into that swine flu pandemic and the British government's response and the press and scientific reports have generally described that influenza pandemic as a mild one, at least insofar as the United Kingdom was concerned?
Yes.
2012, coronavirus MERS-CoV. Is that the Middle Eastern Respiratory Syndrome coronavirus? Global deaths 866, UK cases 5, UK deaths 3, but the case fatality rate was very, very much higher at 34.3%. Again, a respiratory disease.
Yes.
Can you say anything about the difference between that coronavirus, MERS, the Middle Eastern Respiratory Syndrome, and Covid-19 in terms of whether or not it differed, in terms of whether it was symptomatic or asymptomatic, or whether or not as a disease there were different methods of transmission? So, for example, whether or not it was a disease transmitted more by aerosol droplets from higher respiratory tract or lower down in the chest.
Yes, so I believe Professor Heyman will go into more detail on this tomorrow as well. But generally speaking, MERS is transmitted quite differently. There's 2 main routes. So MERS is entering the human population primarily from camels, dromedary and camels. So one route of transmission is very close contact with an infected dromedary and camel. who, as far as I understand it, can have MERS asymptomatically. The other route of transmission, which is the route that the larger MERS outbreaks have gone through, is within a healthcare setting. Again, very close contact, and there you can have either transmission from patient to patient or from patient to healthcare worker.
But the degree of human-to-human transmission for MERS was very different to that of COVID-19.
Yes, indeed.
So although it could be transmitted human to human, it was only in those very confined healthcare settings that it actually took place. And then Ebola at 2013 to 16. So far, the highest case fatality rate, 62.9%, but it's not an epidemic or pandemic that has afflicted the United Kingdom. There have been 3 cases and no deaths. And then finally down to coronavirus SARS-CoV-2, our COVID-19. And to put that terrible disease in its context, we can see in the middle of the page global deaths range from an upper figure of 30.6 million to a lower figure of 6.9 million. Of course, there are different ways of measuring deaths. And in the United Kingdom, more than 90% of the population is assessed to have been infected by the disease, to have caught it, and they have official figures recount being 225,668 deaths. The infection fatality rate is something different to the case fatality rate, is it not?
It is, yes.
What is the difference?
So the case fatality rate takes the proportion of cases, so people who have become ill, whereas the infection fatality rate takes the proportion of infected people, including those asymptomatically infected.
So essentially, case fatality rates rest upon a confirmed case of infection. There has to be an identified case, whereas an infection fatality rate is an assessment based on those who have become infected, whether or not that is being confirmed in some way or not.
Yes and no.
Of course.
I think I'm going to need you to run it past me again.
Doctor.
I'm afraid, Mr.
I'll try my best to do that. So with a case fatality rate, we usually specify what cases we mean. Do we mean only confirmed cases? If so, confirmed how? Laboratory confirmed or confirmed by a clinician? Or do we also include, for example, probable cases or suspected cases? With the infection fatality rate, this becomes a little more complicated because it is very difficult to assess the extent of infection, especially with diseases that can occur asymptomatically, which also means that in many cases our confidence in the infection fatality rate is lower than in the case fatality rate because there is a certain amount of estimation of the total number of infections.
All right, thank you. Standing back and looking at that chart, in 2019, SARS-CoV-2 was therefore the third coronavirus pandemic, but the second SARS pandemic. There had been one SARS pandemic, the coronavirus SARS-CoV-1 in 2002, and then the coronavirus MERS pandemic or epidemic in 2012, and therefore COVID-19, the third in 2019. Are coronaviruses common in animals such as bats and civet cats and camels and so on?
Indeed they are.
Are there hundreds?
I believe so.
If not thousands.
If not thousands. But not all of them infect humans.
No.
Do a significant proportion?
There's, I think, 4 endemic coronaviruses that affect humans, and they cause mild common cold symptoms. And then there are these 3 more recently experienced coronaviruses that have caused epidemics in the human population. So of these thousands of coronaviruses, there have been just 7 that we're aware of that affect humans.
And what does endemic mean, to which you referred?
Endemic means that it is constantly within the human population.
Does the fact that there have been 3 coronavirus pandemics in relatively short order in this century indicate anything at all?
That is a very good question.
I'm very glad to hear that.
Probably one that can't be answered with full certainty. Now, certainly it does point to the issues we covered before in terms of increasing human-animal interfaces. But beyond that, it's probably very difficult to say anything. And indeed, what we haven't covered, what is on the top of this page, but going further back even, we can't with certainty say how many coronavirus pandemics there have been throughout history.
Could we then put that chart aside, please, and return to your report at 196611 and page 5? And if you could zoom in, please, on paragraph 2. As you might expect, Professor and Doctor, the United Kingdom government, as with many other governments, has long acknowledged the risk posed by biological or zoonotic diseases and disease generally, and the international nature of biological threats has long been classified as what is called a Tier 1 risk by the United Kingdom government. Is it obvious that, therefore, such risks have long been part of the United Kingdom's preparedness planning?
I would assume so.
All right. You turn further down the page to the 3 broad categories of biosecurity threat that we currently face. And at paragraph 4, you set them out as being in 3 categories: zoonotic spillover, antimicrobial resistance, and human origin biosecurity risks. Zoonotic spillover you've already described as being a leak, if you like, or a transmission between animal and human over the zoonotic interface. But what is antimicrobial resistance?
So antimicrobial resistance is a natural phenomenon of microorganisms, so for example bacteria, viruses, adapting to, broadly speaking, their environment. And that environment for these microorganisms includes drugs we use on them, so things like antibiotics. So that then means that those microorganisms adapt and learn how to deal with those drugs, which brings considerable harm, as it means that things which we thought we could treat become less treatable, even untreatable, and also because large parts of modern medicine, particularly surgery, rely on us being able to control bacterial risks.
The third category, the deliberate and accidental release of pathogens, the human origin biosecurity risks, is self-evident, and we'll come back to the detail of that in a moment. So with those 3 categories broadly in mind, can we just focus, please, for a moment on zoonotic spillover? Does zoonotic spillover present a range of risks or effects. Can it be that following a zoonotic spillover that there may be limited or no risk for the human race? Or can it have, and does the evidence show that it has had potential pandemic impact?
Yes.
Is there anything that can be said about the degree of risk? So, for example, can it ever be known in relation to a zoonotic spillover whether or not the impact will be towards the bottom end of that chart of impacts or towards the upper end, towards the pandemic end?
We see the whole range, and even within individual pathogens, we can see a broad range. If we take, for an example, stepping back from coronaviruses, if we take Ebola as an example, we see quite a number of spillovers of Ebola where we have a handful of cases. And then we also see large outbreaks like the one referenced in the table, the 2013 to 2016 outbreak in West Africa, or the more recent 2018 to 2020 outbreak in the Democratic Republic of the Congo. So there we see even within one pathogen we have considerable variance.
And can such zoonotic spillovers be viruses or coronaviruses or?
Well, they can be viruses, they can also be bacteria, so this is not just viruses. If we take, for example, the plague, some of you may know that as the Black Death from the Middle Ages. That is a zoonotic organism as well. So I think most of us will probably know the stories from the Middle Ages, plague coming from rats with a flea in between probably. So there you see another example of a zoonotic pathogen, this time a bacterium.
Mr. Keys, forgive my interrupting. I think you've been pushing your luck with our very patient stenographer, so would you like to choose a moment?
That's an ideal moment, my lady.
Thank you all. Thank you very much, Professor and Dr. Hammer. We'll return at 1:45, please.
All rise.